control is essential health care. Full stop. And we need to allow families and individuals to plan for their own lives, whether they want to start a family or not start a family, pursue their dreams and achieve their full potential. And it comes down to half the population, women having full control over their own bodies. And we also want to make sure that they have birth control easily available to deal with other health care problems that arise, endometriosis, irregular cycles, acne, and others. That's why just moments ago, joined by Commissioner John McDonald, not John McDonald, I'm sorry, Jim McDonald, his brother's on my mind, Commissioner Jim McDonald, who I witnessed sign an order that going forward that individuals without a prescription can now go to a pharmacy to secure the necessary birth control. You know, we talk about the challenges that we're facing here as a nation when it comes to the rights of women. It's been a hard, discouraging time for all of us. And when Roe v. Wade was overturned in 2022 by an extremist far-right Supreme Court, we faced a turning point because people started saying, well, what next? Because that was considered fairly sacrosanct in our country. And you think about the fact that generations of fighting and advocacy and marching in the streets and petitioning legislatures and the Supreme Court to do the right thing, all of it was just reversed with the stroke of a pen. And we realize now that that was just the beginning. States have now been enacting abortion bans for as little as 2 weeks, restricting access to medication abortion, and of course, why not go after IVF as well, because they don't respect the rights of anyone to control their bodies. And Congress members, Republicans in Congress, even blocked a bill that would have protected the right to contraception. And women across this state, I speak on behalf of all of them, are sick and tired of extremist judges and legislators and even candidates for president who are willing to entertain the thought of a nationwide ban on abortion. What have we come to? Discouraging to say the least. And that's why as governor, I've worked hard to remind everyone here that as long as I'm governor, their rights are protected, that this is deeply personal to me as a mother and a woman in this state. And I want to make sure that New York remains a sanctuary for all levels of care for women. And we talked about this in the past. We directed initially a $35 million access to increase access to reproductive health care, mandated that all insurance companies in the state of New York cover abortion, and we stockpiled medication abortion pills when there was a threat to those as well. But now we wanted to fulfill my commitment that I made in 2023 to make birth control easier to access. Starting today, pharmacies are now allowed to dispense 3 different types of contraception medication, and any woman can walk into a participating pharmacy and choose the birth control method that best suits her needs. And this will dramatically increase access to this for women, particularly at a time when women are feeling discouraged and not listened to and powerless. That here in New York, you have the power to walk into a pharmacy, just like where we are here today, and to make that decision that I want this. I want to be able to control the process. I want to control my life. I want to have my rights back again. So it's just a start. It's important, but especially for people who live in parts of our state where getting an appointment with the doctor could take months and months and months, and that's the reality that many live with. Rural areas, urban areas, there's a lot of parts of our state that's just a big hassle to walk in and get that prescription, and then they're not protected and able to control their own destiny. So even if you, like I said, if you live even close to a doctor, it takes so long now to schedule appointments. And it shouldn't be this hard to access basic health care needs. It's not about convenience, it's about our statement of our values. And so we continue the fight every way we can. Again, I thank Commissioner McDonald for his work on making this become a reality. It was passed last May 2nd. We signed it May 2nd. The effective date was January. We had to wait for the Department of Education to establish the rules around this and make sure that they had the regulations in place, and that was just accomplished March 12th. And now that that's been done, we wanted to join here today and remind women across the state of New York, it's a new day. You now have access, easy access, to the contraception that you choose to fit your own personal health care needs, because it is your body and it is your choice. Commissioner McDonald, any comments?